Bobby from Mangiarelli Rehab. I just want to do a quick video on discussing medial elbow pain, especially this time of year where individuals are going to be out golfing, and it's a common injury we see with golfers and also those who work with their hands a lot, where they're a lot of twisting motions in their wrists. So I just want to show you a couple exercises that you can do to help kind of strengthen the medial elbow or the inside of the elbow, and especially if you have pain, these are things that can help with that. So when it comes to golfer's elbow, we're talking about pain right along the bony part of the inside of the elbow, and a lot of it's happens because of repetitive activity. So you think about like a golf swing, repeating that motion. If somebody's working underneath a car with a wrench, all those motions kind of aggravate the soft tissue on the inside of the elbow. In order to help with that, we usually recommend getting an evidence-based exercise program. And a couple exercises that I'm going to show you today are kind of what the evidence shows on what you can do to help with your symptoms, but also improve your strength and your function so that something like this doesn't occur as often. Okay? So once we kind of figure out that you have medial elbow pain, these are some of the movements that we're going to do. It doesn't take too much equipment to do as well, so it makes it really easy, and you can do this at home. So in order to kind of strengthen the medial elbow, what we're going to do is we're going to take a weight, and we want to make sure our elbow is flat on the table. And we're going to be strengthening a lot of the muscles on the kind of the palm side of the forearm complex. And the first movement we're going to do here is just work on bending the wrist up towards you and then coming back down. So usually we're going to kind of shoot for anywhere between 6 to 15 reps, 2 to 3 sets of those. You want a weight that's challenging, so you're going to kind of feel this work along the muscles on the forearm here. Okay. If that's really painful early on, what you can do is just hold your arm out, and then you're just going to push and you're going to hold. And this is what's called an isometric. So it's just basically contracting the tissue along the inside of the elbow, and to help build some tolerance and some endurance, so that eventually you can do something where you're providing a little bit more range of motion. Okay. The other one you're going to do is not only the muscles of the kind of the medial forearm, bend the wrist up, but also they do rotation, which we would call pronation. So what we're going to do here is we're just going to take a stick, or we can even take the weight. In this instance, what you're going to do is you're going to just work on rotating the stick outward and then coming back to neutral, or you can even go beyond that. Okay. So again, these muscles help kind of rotate the forearm inward. Okay, so working on strengthening the muscles of the forearm, help building resiliency of the medial elbow. Okay. Now, if you use a stick like this, you can have a long lever, so you can reach all the way down here and make it a little bit harder. If that's a little bit too difficult, you can shorten it, and you can even apply a weight on it. So in this instance, we could take our weight here and condition and strengthen the muscle doing it this way. Okay, so that's the second exercise. The last one would be to take like a weight, and what you're going to do is you're going to grab the end of it, and what you're going to do is you're going to bend the weight up towards your elbow, just like this. Okay, so think about the position of my hand, just like my arms to my side. And I'm just going to lift up, hold it there for a second, and then come down. And same thing, we're going to be shooting for about 6 to 15 reps, something challenging that you really feel like it's working, those inside elbow or inside forearm muscles. Okay? On top of that, there's some soft tissue modalities that you can do to help with your symptoms. We recommend that you come see us if that's the case. There's a lot more progression of exercises that we can do to help you return back to golfing, whatever activity it is. So if that's the case, come see us, and thanks for watching.